paper is like we have discussed most of the questions. Okay, so the first question is the CT images shown below depict a condition due to an elongated styloid bone. Okay, so the first thing that comes to our mind that it's an elongated styloid bone, it's going to be Eagle's syndrome. Okay, so what are the things that are associated with Eagle's syndrome? First, that you will have some disturbance, some pain during swallowing, deglutition. Okay, and then during the movement of your neck, there's going to be pain, there's going to be headaches. Okay, so these are the things that are associated with elongated styloid bone. Okay, so here you can see this is what is this? This is basically a coronal part of an axial bone, axial slice, in which you can see this area which is elongated. This is the styloid bone. Okay, so the question that is asked is, the CT image shows below to depict a condition due to an elongated styloid bone. So we know that it's an Eagle syndrome. Now, what is the pathology associated with this condition? Okay, so they are basically asking, we all know, they have not asked a direct question कि भैया आपसे सीधे नहीं पूछ लिया कि ये ईगल सिंड्रोम है, आपसे पूछा है कि ईगल सिंड्रोम जो इलोंगेटेड स्टाइलॉइड बोन के कारण होता है उसके साथ आपकी क्या क्या पैथोलॉजी एसोसिएटेड हो सकती हैं. सो ऑप्शन ए इज ग्लॉसोफेरेंजियल न्यूरैल्जिया, ऑप्शन बी इज ऑटिक न्यूरैल्जिया, option C is post-herpetic neuralgia, option D is trigeminal neuralgia. So the correct answer here is glossopharyngeal neuralgia. The condition या Eagle syndrome के साथ एक न्यूरैल्जिया जो एसोसिएटेड होता है वो होता है glossopharyngeal neuralgia. Post-herpetic neuralgia is most commonly seen in herpes zoster virus. Sometimes आपका ग्लॉसोफेरेंजियल न्यूरैल्जिया के जो लॉन्ग स्टैंडिंग केसेस हैं कैन कन्वर्ट इनटू ट्राइजेमिनल न्यूरैल्जिया, बट दैट इज 1 in a million केस. सो द करेक्ट आंसर हियर इज आंसर ए, दैट इज योर ग्लॉसोफेरेंजियल न्यूरैल्जिया. ओके, नेक्स्ट. A fresh film test will show. बेसिकली अ फ्रेश फिल्म टेस्ट मतलब अगर आपने एक फिल्म ली अनओपन्ड, ओके, अनओपन्ड, आप उसको खोलोगे और वहीं पर आप निकाल लोगे तो दैट इज अ फ्रेश फिल्म. सो दैट विल अपीयर एज व्हाट? ओके, सो ऑप्शन ए दिया है डार्क फिल्म. दिस इज मोस्ट कॉमनली सीन when it is exposed and developed. Okay, so it is not a fresh film anymore. Okay, the answer will be clear film and it comes with a blue tint. Basically a fresh film will show a blue tint with a clear film. So the answer here is option D, clear film with blue tint. Okay, I'm not going to discuss the oral medicine. I'm going to leave that part for the oral pathology, Pawan sir. Okay, and I'm only going to discuss the oral radiology questions. Next is a 10-year-old boy comes with multiple carious teeth. Okay, there are multiple carious teeth in this OPG. He is treated for Hodgkin's lymphoma at 2 years of age with therapeutic radiation and chemotherapy. What is the effect seen on the roots of permanent teeth? Option A is fusion, option B is gemination, option C is stunting, option D is concrescence. Okay, so fusion, gemination, concrescence, these are most commonly genetic. These are not commonly seen with therapeutic radiation and chemotherapy. What is seen with therapeutic radiation and chemotherapy is stunting of teeth or also known as dwarfism of teeth are seen in cases of radiation and chemotherapy. So the correct answer is stunting of teeth or dwarfism. So इस question का correct answer is stunting of teeth or dwarfism. Next, if the coronal pulp chamber is long and wide, what is it called? If the coronal pulp chamber, okay, basically आपका coronal pulp chamber ये वाला एरिया है, जब ये एरिया लॉन्ग एंड वाइड होता है तो उसको हम क्या बोलते हैं? बेसिकली उसको हम बोलते हैं थिस्टल पल्प. थिस्टल पल्प. और ये कंडीशन कहां देखी जाती है? दिस इज सीन इन डेंटिन डिस्प्लेजिया टाइप 2. So if the coronal pulp chamber is long and wide, it is called thistle pulp. Okay, it is called thistle pulp. ठीक है, थिस्टल पल्प बोलते हैं उसको, जो हमें डेंटिनल डिस्प्लेजिया टाइप 2 में दिखता है. ओके, नेक्स्ट, पैरालैक्स अनशार्पनेस of image is due to. Parallax unsharpness of image is due to. अब आपको इसके अंदर ऑप्शंस दिए हैं. reduced exposure time, no. paralleling technique, no. parallel है इसका मतलब paralleling technique होगा, no. high speed film, no. correct answer is double emulsion. okay, so हम double emulsion में क्या होता है? You have a double coated film. So what happens when the X-rays pass through first emulsion? Now what is the property of X-ray? They tend to diverge. They tend to diverge. So when there is a double coated emulsion, the X-rays that are diverging, already diverging, पहले इमल्शन से पास होने के बाद वो दूसरे इमल्शन तक पहुंचने तक और डाइवर्ज हो जाती हैं. तो व्हाट डज दिस रिजल्ट इन? इंक्रीज्ड मैग्निफिकेशन. दैट इज योर पैरालैक्स अनशार्पनेस. सो करेक्ट आंसर इज डबल इमल्शन फिल्म में. इसकी सबसे खास बात क्या होती है डबल इमल्शन की? कि हमें रिड्यूस्ड एक्सपोजर टाइम मिल जाता है डबल इमल्शन के कारण. लेकिन इसकी एक छोटी सी प्रॉब्लम है, बहुत बड़ी प्रॉब्लम नहीं है पैरालैक्स अनशार्पनेस, कि इसके अंदर थोड़ा सा आपका डाइवर्जेंस के कारण मैग्निफिकेशन आ जाता है. सो द करेक्ट आंसर फॉर नंबर 8, पैरालैक्स अनशार्पनेस ऑफ इमेज इज ड्यू टू डबल इमल्शन. नेक्स्ट, पैरानेजल साइनसेस आर बेस्ट व्यूड बाय. For reverse Tomans, it is a good X-ray for subcondylar or condylar neck. Correct answer is Waters view, then is Caldwell view and Granger view. Correct answer is Waters view. So Waters view क्या होता है? Basically आपका Waters view is your PNS view, also known as paranasal sinus view, or also known as 37-degree occipito-mental view. This is the view of choice for paranasal sinuses. So you can see all the paranasal sinuses except your sphenoid sinus. Okay, your sphenoid sinus cannot be seen in your Waters view. You can see your anterior ethmoidal sinuses, you can see your frontal sinuses, and it is the X-ray of choice for your maxillary sinus. Okay, so these were the questions. I have kept it short and sweet. Okay, if any problem, any thing you haven't understood, वैसे तो it was a very straightforward question paper. I hope you all have done well. Okay, so we will end this session here. Thank you.